confirmed number of new coronavirus cases reported in Los Angeles County over the last 24 hours is 34,827 with 15 additional deaths. Here in Torrance, 283 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Christine Lee. It's Wednesday, January 12th. LA County's public health director is urging residents to avoid non-essential activities in the coming weeks. That means avoiding all activities that are not absolutely necessary and places where people are unmasked and in close proximity to others. This comes as the county continues to experience pandemic high levels of daily infection cases and high rates of virus transmission. Dr. Barbara Ferrer says even if you are vaccinated and boosted, stay away from indoor gatherings and from mingling with unvaccinated or higher risk individuals. She says it's important to exercise more caution during this critical time, which includes wearing a high quality mask whenever people are around non-household members. Health officials say a key difference between the current surge and last year's surge is that while ICU admissions for COVID-19 are only about 10 to 15%, there is a shortage of staff at hospitals due to the large number of workers testing positive. The county's health services department says several hundred healthcare workers are out due to such illnesses, making it virtually impossible to staff a hospital in a way that meets the state's minimum mandatory staffing ratios. Healthcare workers are pushing back on the state's latest COVID-19 guidance. The California Department of Public Health recently changed its guideline, saying COVID-positive healthcare employees can return to work without isolating if they are asymptomatic. Healthcare workers held a press conference in downtown LA Tuesday asking for tighter controls on testing and isolation periods. The state's public health officials say the new guidance is effective through February 1st and was created due to staffing shortages. But those working in healthcare say it is unethical to put vulnerable patients' lives on the line. A union spokesperson says they are exhausted and overwhelmed. The healthcare workers asked the public to postpone doctor's appointments that are not urgent and called on the LA County Board of Supervisors to step in. Meanwhile, Governor Gavin Newsom was in LA County today voicing his support for healthcare workers at a COVID-19 testing site in Paramount. He said the state brought in more than 2,300 out-of-state healthcare workers to help out with the staffing shortages in California and is bringing another 1,250 workers to support the healthcare system. Governor Newsom also signed an executive order making it easier for school districts to hire teachers and other employees amid staffing shortages. His action gives schools more flexibility in staffing decisions, such as giving additional hours to substitute teachers and rehiring recent retirees for short work opportunities. The order expires at the end of March. Governor Newsom says these are short-term challenges that require short-term and targeted solutions. Many schools have been struggling with sideline personnel after about 6 million K-12 students returned to classrooms following winter break. Governor Newsom hopes to expedite a hiring process that's typically time-consuming and allows school districts to keep kids safely on campuses for the remainder of the year and especially through the next 3 to 6 weeks. European regulators warn that frequent COVID-19 booster shots can do more harm than good. The European Medicines Agency says repeating booster doses every 4 months could eventually weaken the immune system. Instead, they suggest countries space out booster programs and tie them to the onset of the cold season in each hemisphere, similar to flu vaccine strategies. This advice comes as more nations consider giving second booster shots to further protect people from Omicron infections. Israel was the first to start administering a second booster shot to certain populations. EMA spokesperson Marco Cavalieri says we need to think about how to transition from the current pandemic setting to a more endemic setting. He adds that antivirals such as Paxlovid and remdesivir maintain their efficacy against Omicron. Shortages at grocery stores are becoming all too common throughout the U.S. The fast-spreading Omicron variant and severe weather in certain parts of the country are worsening supply chain issues and labor shortages that have plagued retailers since the pandemic began. The American Trucking Association said in October that the U.S. was short 80,000 drivers, a historic high. Add to that delayed shipping of everything from imported foods to packaging, which is printed overseas. Worker illnesses are plaguing this industry as well. Some stores are dropping their usual items because no one is there to make them. The shortages impact produce and meat as well as packaged goods such as cereal. U.S. groceries typically have 5 to 10% of their items out of stock at any given time, but right now, the unavailability rate is around 15%. Experts say pandemic trends like eating at home more than usual are also what's leading to the empty shelves. The average U.S. household spent $144 per week at grocery stores last year, down from the peak of $161 in 2020, but still significantly higher than the $113.50 that households spent in 2019. Well, Canada is now on the highest risk category for travel. The U.S. Centers for Disease Control and Prevention placed the world's second largest country in the Do Not Travel list after reporting more than 294,000 new COVID-19 cases for the week ending on January 8th, its highest weekly total since the start of the pandemic. Canada was joined by the Caribbean island of Curacao and about 80 other countries in the highest risk category. CDC puts a destination at the level 4 COVID-19 very high list when there are more than 500 cases per 100,000 residents registered in the past 28 days. The agency advises travelers to avoid travel to these countries. Canada issued an advisory asking its citizens to avoid all non-essential international travel on December 15th. Most international visitors heading to Canada are required to be vaccinated and to have a negative COVID-19 test result. Fire specialists shared tips on using a space heater after tragic fires broke out in New York and Philadelphia over the past week, leading to dozens of deaths. A malfunctioning electric space heater sparked a blaze that claimed the lives of 17 people in the Bronx last Sunday. And 1 week ago, a similar fire killed 12 people. Both cases involved many children. The National Fire Protection Association says space heaters account for 44% of home heating-related fires and 85% of associated deaths. To prevent such fires, they say be extremely careful. If possible, choose a space heater with a thermostat, overheat protection, and auto shutoff when it tips over. Other tips to consider include putting the space heater on a bare, smooth floor, keeping it off of rugs and carpet, not tilting it in any way, keeping it away from wet locations such as a bathroom or a kitchen unless it's designed for it, plugging the device directly into a wall outlet instead of a surge protector or an extension cord, and keeping the space heater a few feet away from the wall where it's plugged in. The Consumer Product Safety Commission recommends using the 3-foot rule, keeping the heater 3 feet away from anything flammable such as curtains or furniture, and from people as well, especially children. Never leave a space heater on in a room that is unattended, and turn it off and unplug it before going to bed. The annual Greater Los Angeles Homeless Count takes place over 3 days and 3 nights in the month of January. For the past few years, the city of Torrance has served as a deployment site and partners with the LA Homeless Services Authority, local municipalities, law enforcement, and community members. This year, the count is taking place on Wednesday, January 26th at the Ken Miller Recreation Center. The homeless population and the data is collected and helps organizations advocate for the unhoused and allocated resources needed to help everyone experiencing homelessness. You do not need any prior experience to volunteer. Due to the pandemic, volunteers are being limited to 2 to 3 individuals from the same household. If you are under the age of 18, you must volunteer with a parent or guardian. Families can register together at theycountwillyou.org/Torrance_count_2022-01 826. If you have any questions about the registration process or to confirm your registration status, contact Nancy Wilcox at nancywilcox777@gmail.com. By following guidelines, participating is safe and easy. Every other week, we share a Wellness Wednesday story to help you stay on top of this pandemic, both emotionally and physically. 2022 is starting out much like 1 year ago, when a COVID-19 surge led to crowded hospitals and a significant spike in cases. Since last year, we've been in touch with Dr. Jorge Vournas with Providence Little Company of Mary Medical Center. He's kept us up to date on the latest developments at his hospital and is giving us tips again on how to best avoid getting sick. Dr. Vournas, thank you so much for joining us again.
Thank you for having me today.
So let's dive right in. We're talking about hospitalizations going up throughout LA County and really throughout the state and everywhere else. How is the situation where you're working?
It has gotten really crazy again. I mean, I think from just a month ago, we had only a handful of COVIDs in the hospital. Now we're close to 100. In the last couple of weeks, we went from 0 to 100. The good news is that the patients who are sick enough to be hospitalized, many of them don't need ICU care. They're kind of in a step down area. So it appears the Omicron is a little less, virulent than the prior ones. So we've been adjusting on the fly. We've been adding a lot new additional caregivers, nurses to care for these patients, and opening up surge units. We're also reopening our tent outside the ED to kind of help separate COVID patients from non-COVID patients. So we've been back up and running again with all the factors that we had done before.
Yeah, and we've mentioned that many of the people who have COVID at the hospitals, they initially went in for something else. Is that the case that you're seeing there too?
There's a fair number of, let's say someone comes in with a broken ankle and they just happen to test positive, so it's really unrelated. If they need to go to surgery, we don't test every patient that comes to the hospital, but if they need any procedure to be hospitalized, then they'll be tested. So we do see a handful of people who are asymptomatic and then are there for other reasons. But most of the people who are admitted with COVID, are there because of COVID complications.
I see. And we've also been reporting on a record number of healthcare workers calling out sick with COVID-19. How is that situation where you are?
I think there's been a handful. It hasn't been terrible. I mean, a few that I know of, but I don't have any kind of exact numbers, but it's not terrible, at least where we are.
Well, that's fortunate. And we've also talked about young children, especially those who are less than 5 years old, seeing the biggest increase in recent hospitalizations. Is this a trend you're seeing as well? And what tips do you have for parents to help them, keep their kids as safe as possible?
Yeah, it's interesting. Again, also, this variant is a little different than the prior. In the prior variants, the kids really only had, small colds and didn't have much symptoms. With Omicron, they tend to be more in the upper airway. The kids are getting more kind of croup symptoms from COVID, which didn't happen before. So those are a little different. So the younger kids can get a little sicker with this COVID variant. We're not seeing, I think there's only 1 or 2 in our hospital. If we don't have a pediatric ICU, so if a child is a little more sick, they get transferred to the children's hospital from our hospital. So as far as tips, I mean, it's the same old thing. If they're old enough to wear a mask when they're out, they should be wearing a mask. If you're in school or in daycare, it's probably a good idea to get them tested on some regular basis. And I think that's about it.
Okay. And I can't believe, the first time we got together to talk about your work during the pandemic was almost a year ago. What's the biggest change that's taken place since then?
I think that we thought it was pretty much not over, but in the fall when everything was calm and at least in this part of the country, we hadn't seen almost any COVID, but now it's just back again, and so we're just digging in and getting back to work, and we're making sure we have enough staff, enough PPE. We have all those things in place, so it's just getting back to the way it was.
And new knowledge, right? I mean, from a year ago, you've learned so much more about what COVID-19 is, and you've been able to better adjust as well, right?
Yeah, I think so. I think the treatments are pretty standardized now. I mean, luckily there's a new pill that's coming out. Hopefully, they said it's approved. I don't know when exactly it'll be available to the public. So when that comes out, it will be beneficial for the people who are getting it. And again, this remains to be needs to be said as well that the primary people who are getting sick again from Omicron are the non-vaccinated. I think probably 80 to 90% of the admitted patients are unvaccinated. So it's never too late to get started if you haven't done it at this point. And if you are eligible for a booster, you should get one.
That's great advice. And any last thoughts about where we are now and what we can all do to just hang in there besides getting vaccinated and boosted?
Same old stuff, stay masked when you can. In South Africa, the Omicron kind of came and went pretty quickly. I don't think we've turned the corner here yet, but we just hope that, the same thing happens here.
Awesome. Thank you so much again for chatting with us.
You're welcome.
For the latest information on all things COVID-19 related, log on to torranceca.gov/COVID-19. Torrance City Council members met last night to conduct city business for the first time in 2022. Council members received and filed the COVID-19 recovery update from LA County and the state. They also approved a categorical exemption under the California Environmental Quality Act and awarded agreements totaling about $1.5 million for a 2-year intersection improvement project at Anza, Vista, Montana, and Pacific Coast Highway. And the council members conducted a public hearing and adopted a resolution ordering the vacation of a portion of 242nd Street west of Hawthorne Boulevard. You can watch replays of the meeting on our website, YouTube, Facebook, and of course, right here on City Cable. Well, before we go, at the end of each program, we like to share feel-good stories from our community. Pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. The recent flooding in the South Bay caused quite a scene at the city's Pine Wind Garden. On December 30th, its koi pond experienced significant flooding, causing some fish to escape the pond and swim around in the flood. City crews rushed over to reduce the water levels and protect the fish. Thanks to their quick action, the pond was restored and every fish has now been accounted for. We are told they are all in good health. What a relief. Thank you to the crew members for restoring Pine Wind Garden so the public can come and enjoy it again. Now, if you have a great story, an upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as Bella Shaw brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.